All good.
How we doing?
Hi, how are you? Good to see you.
As always, yes.
Thank you for joining us, and we're gonna start the conversation. Thank you to everyone for joining us today. In today's conversation, we're going to be talking about how we can create safer communities and why mass incarceration fails. Just a brief overview of our agenda, give you some insight into the Office of the Public Defender, a brief history of mass incarceration, define the crisis in Maryland, and discuss ways in which we can develop solutions that include medical and geriatric parole, as well as second look, and then give you an overview of upcoming community events. Many of you are already aware the Office of the Public Defender encompasses the entire state of Maryland, and we have offices in every district, so that makes us 52 offices statewide, and we are divided into 12 geographical districts that are in line with Maryland's district courts throughout the state. Our motto is justice, fairness, and dignity for all. And in addition to our district offices that are throughout the state, we have specialized divisions. So we highlight a few here that are really pertinent to today's conversation when we talk about mass incarceration. And amongst our specialty divisions, that includes our Innocence Project Clinic, major crimes and complex litigation, post-conviction, social work, and of course, our external affairs is what's bringing us here together. I highlight those particular divisions because, again, they go to the heart of our discussion today. Our Innocence Project Clinic serves individuals who have been wrongfully convicted. Post-conviction represents individuals who are currently incarcerated or on parole, and our major crimes, complex litigation assists our trial teams, especially in issues that require an additional, more intense level of expertise. And of course, our social work division works with our attorneys throughout the state. They're an integral part of the team, and our licensed social workers are really important, especially when we talk about issues of reentry and mass incarceration. They provide important expertise in regards to mitigation. They help in terms of maintaining client communications and in developing reentry plans. So before you can intervene in a social problem, you need to have context. So that means we have to analyze it from a historical perspective, look at the economics and the environmental factors that shape the situation. We also must assess the effect on the people that are impacted, as well as the stakeholders and those who hold the power in these various dynamics. So by doing this, it is critical, and it helps us to avoid making assumptions, and it helps us in imposing solutions, and it makes sure that we don't overlook important opportunities. So the data that's presented here speaks to the reality, and we're looking at data that reflects 2021. And so in 2021, over 71% of Maryland's incarcerated population was reported as Black. That is compared to 29% of the state population. I'm sorry, I said that totally wrong. 71% of Maryland's incarcerated population was reported as Black. That is in comparison to the state population, which is 29%. And just to be clear, I'm going to say it again. In 2021, 71% of those individuals that were incarcerated in Maryland jails and prisons were in fact Black, whereas the state population during the time was only 29%. Now, we often hear and talk about this number because it is extremely important when we're speaking about the issues of mass incarceration and its impact on Black and Brown communities. The horrific fact is that Black people in Maryland are incarcerated at a rate of 5.3 times higher than white people, and that this disproportionate incarceration of Black Marylanders has an exponential harmful impact on communities. When we talk about mass incarceration, we are speaking about the traumatic and oppressive criminal legal system, the encounters that are passed down from generation to generation. Mass incarceration and extremely long sentences cause irreparable harm, and these racial disparities exist at every stage of the criminal legal system. We talk about from policing to pretrial to prosecution to sentencing and incarceration through the extensive periods of supervision and have significant collateral consequences that follow. This, in fact, leads to intergenerational trauma. When we talk about intergenerational trauma, we're referring to trauma that is passed on from perhaps a survivor of a traumatic situation to their descendants. And this trauma can start with one traumatic event that impacts the person or a collective trauma that affects a larger community. In this case, we're talking about the effects on individuals and families from being removed from the community and experiencing long periods of incarceration. So here it speaks to the incarceration hotspots in Maryland in 2020. And this is a report from the Prison Policy Initiative that describes the high incarceration rate of some neighborhoods in Maryland. So here you see that Baltimore City contains 9% of Maryland's population, but 40% of prisoners in the state originate from Baltimore City. Many census tracts on the Eastern Shore, when we look at a rural area of Maryland, which is poor and white, in central portions of the state, it also reflects elevated rates of incarceration. We also know that those who experience higher rates of incarceration, more likely to have higher unemployment rates, lower educational attainment, decreased life expectancy, and also in those communities, you have a larger number of vacant property, as well as an increased number of poor health indicators. This map uses spatial analysis to identify neighborhoods where you see incarceration clusters. And this is also referred to as hotspots or cold spots. And this is reflecting in terms of when individuals are returning back to the community where they are returning to, as well as the areas in which individuals originate. So how did this all come about? Well, essentially, when we talk about the history of mass incarceration, we have to talk about mass incarceration has roots in slavery. It has roots in the racial, social control elements in terms of how we treat individuals, how we treat individuals in marginalized communities. The United States has an over-reliance on prisons. And this goes back to the late 1960s and early 1970s. We think about in 1967, the Kerner Commission came out with the report entitled The Challenge of Crime in a Free Society. And it put forth approximately 200 recommendations that talk about policing, the courts, corrections, juvenile delinquency, organized crime, narcotics, the war on drugs, and essentially this encouraged the federal government to invest in the modernization of police departments. It resulted in the improvement of weaponry that was available for law enforcement, And it really, from that point, built upon how we treated communities, especially marginalized communities, and how we looked in terms of how we were going to deal with crime in the big and small areas. Then we turn to the war on drugs and essentially the Anti-Drug Abuse Act of 1986 that created huge disparities in sentencing. And you recall the huge disparities between crack and powder cocaine. 1986 was also a memorable year for bad reasons for Maryland. If you recall, in June of 1986, star forward from the University of Maryland basketball team, Len Baez, died of a cocaine overdose. And this was merely 2 days after he had signed with the Boston Celtics. There was a media frenzy that was created amid news of his death. And that was also amid the national panic over crack. And essentially it set off alarms. This was also fueled by way of violent crime in American cities, especially in Black neighborhoods. So under this Anti-Drug Abuse Act of 1986, we found that a person was sentenced to a 5-year minimum sentence for 5 grams of crack cocaine, but it took 500 grams of powder cocaine to trigger the same sentence. So we found that in poorer communities, crack is a cheaper alternative to powder cocaine. You found that was more predominant in low-income neighborhoods, that were predominantly Black and brown. In urban areas were also over-policed, and essentially you had the growth in the disparity of treatment. We continue talking about the war on drugs and how we must also emphasize how it unjustly funneled Black individuals into the criminal legal system. The war on drugs focused on small-time drug dealers who are generally poor, young Black males from the inner city. And this ultimately caused a prison population that doubled due to the arrest of drug dealers and their customers. With the proliferation of mandatory minimum sentence during the height of this war on drugs era, you had unnecessarily long prison terms with essentially callously given out, and you had shockingly severe drug sentences where individuals were receiving 10, 20, 30 years, even life imprisonment. This essentially traumatized communities, snatched parents from children, broke up families, destabilized families, broke down the structure of the neighborhood, and this became commonplace. And essentially this was the root of many of the ills that we still see today. And is a great example in terms of how systemic racism was an integral part of the disintegration of neighborhoods and the breakdown of families. So then we came into 1994, and that was essentially the beginning of the lock 'em up era. We saw that the 1994 crime bill encouraged states to pass more tough-on crime laws and implement harsher practices to lock up more people for longer periods of time. During the 1990s and the 2000s, the number of felony cases filed in state courts went up despite lowering crime rates. In the book Locked In, Fordham University law professor John Paff notes that the probability that a prosecutor would file felony charges against arrestee basically doubled in those decades. And being in this space of public defense, we saw that as the prosecutorial discretion became greater and greater, and was expanded by the courts and laws that were passed. Public defenders agencies such as ours continued to suffer in terms of funding and resources, despite the fact that number of cases were increasing and workloads were multiplying. We continue to be plagued by the mistakes of the past. In fact, September the 13th of this year marked 30 years since the signing of the 1994 crime bill. And it's important to note and think about the mistakes of the past and not repeating them as we move into the future, that this crime bill was in fact supported by many, including the Congressional Black Caucus. And the reasons for a vote in favor of the bill back in the early 1990s was essentially that crack cocaine was a scourge in the Black community. And essentially leaders wanted it out. They wanted to rid their communities of this heinous and vile drug and those who were pushing it. So many voted in favor of the bill. I also note that there were key Congressional Black Caucus leaders who voted no on the bill, and that included John Lewis, Maxine Waters, and John Conyers. And I make note of that because, again, it's important to know the history and why the bill was supported then, so that we do not make the same mistakes now. And though there were those who are well-intentioned, wanted to rid their communities of the harm that were being plagued upon them, we have to learn from history, and especially things that happen at the federal level, that we should not repeat on the local level. We should look at bills with heightened scrutiny, and with the understanding that bills that eliminate bills that allow mandatory minimum penalties, in fact, eliminate judicial discretion, do not allow the court to really look at the circumstances of the individual or treat the individual based upon their direct involvement in the situation. History, in fact, presents a cautionary tale in terms of where we are today in 2024. And we know that after 30 years, this bill has done nothing to improve our communities and make us safer. So we are at a pivotal point in history where we have the ability to make significant change to repair the harms that had been caused by decades upon decades of bills such as this. So mass incarceration is nothing new. The ACLU reported that as of 2001, the number of African-American men that were incarcerated in US prisons was 792,000. This number is equal to the number of men enslaved in 1820. So again, mass incarceration is nothing new. You think about the war on drugs, mandatory minimum sentence laws, and other policies, such as we saw in the past, which include eliminating the eligibility of Pell Grant loans, so that individuals did not have the opportunity, once they were released from prison, to further their education. These type of policies have disproportionately targeted and impacted African Americans and other minority groups, and this has led to the disproportionate number of people of color, especially Black people, being incarcerated. So again, we have a showing here of how the federal crime bills and rhetoric have impacted Maryland. Maryland essentially fell in line following a tough on crime stance. And you can see here how Maryland increased its use of life sentences in the 1990s. So on October 1st, 1994, Maryland enacted a law that required individuals serving a sentence on a crime of violence to serve 50% before parole eligibility. Now, before 1994, the parole eligibility was just 25% of the sentence. This same eligibility for nonviolent offenders. So Maryland's prison population essentially tripled between 1980 and 2013, ranking 7th in terms of the amount spent per capita on the justice system. And Maryland spent 1.3 billion on state corrections in 2013. Maryland spends more than 10 times as much on corrections as it does education. And I repeat that, Maryland spends more than 10 times as much on correction as it does on education. Its prisons reach nearly their full capacity by 2010. And this is although the prison population has decreased over the last few years. And the point here is really to show that even though prison populations are on a decline, that Marylanders in state prisons have been there a long time and have long since aged out of crime, but continue to remain incarcerated. They are dying in prisons, and that is at a great cost, not only to themselves and their families, but is at a great cost to taxpayers. We also have to think about, in terms of racial disparity, which was exacerbated by Governor Glendening. That was the era in which life means life. So between 1969 and 1994, Maryland paroled about 181 lifers. In the following 2 decades, there were none paroled. At the same time, the disparity in the imposition of life sentence based on race continued to grow. So put it in context, in the heat of a tough on crime campaign in the 1990s, Governor Glendening declared that he would reject all lifers for parole, even if the parole commission made that recommendation for release. This policy, maintained by governors from both parties, left hundreds of prisoners with parole-eligible sentences, essentially within jails. The vast majority of these individuals with parole-eligible sentences were Black men, and essentially these are individuals who were permitted to continue to grow and die in prison, even though they were eligible for release. This slide is really important because it shares the information and the true reality of who is actually currently housed in Maryland's prison population. And you think about that the prison experience in America generally, but Maryland specifically, is harsh, restrictive, and dehumanizing. So who's there? So we have individuals who themselves have been victims and experienced trauma. We have individuals who are suffering from substance abuse. We have those who have disabilities. We have those who are essentially indigent and poor. We have those who have low levels of education. And we have a significant of those individuals who are suffering from mental illness. That is the population of individuals within Maryland's prisons. So we've talked about the history of incarceration in Maryland, and we've talked about who is currently being housed throughout the state, mainly Black and brown people, in particular Black men. So let's move to as to what in fact does work. What we do know works is rehabilitation and restoration. Mass incarceration focuses on retribution, which was spurred by this 1970s ideology that nothing works. Essentially, that there's no point in investing in rehabilitative programming intended to prevent recidivism, because essentially there was a belief that this was not going to work. But what we do know, what science tells us, that rehabilitation and restorative justice, in fact, do work. And as stakeholders, policymakers, it is our duty to essentially to modify the focus and essentially move from retribution to that of rehabilitation and crime prevention. And crime prevention includes us focusing on restorative justice practices. And when we look at restorative justice practices, there is a greater focus on rehabilitation through reconciliation. And this has been proven to reduce recidivism, as well as reduce the harms that are placed upon society, and bring a greater degree of closure and wholeness to the victims and the family members. It's important that as community, we provide offenders with an opportunity to make amends directly to those whom they impacted. And this is definitely helpful in terms of the healing process for all those involved. This is a more positive approach that can help empower all those involved, develop healthier relationships, and which is very critical, especially when we're talking about individuals who are re-entering a society. It is important that we identify positive ways to rehabilitate individuals, because what history has shown us is that the things that we've done in the past are not and have not worked. So when we talk about prevention, it is important to emphasize that prevention does in fact work. But in order for us to be in that place, we have to ensure funding for proactive community programming. We have to provide resources. And this is key if we are going to reduce our prison population in Maryland. To ensure a better future, Maryland must focus on a public safety plan that is rooted on prevention, services, and support. Our answers to public safety cannot simply be reliance on law enforcement. We have to establish communities where there are economic opportunities. We have to establish communities that have well-paid, stable jobs that allow individuals to meet their needs, to meet their family needs. We have to grant individuals access to quality housing, access to food, healthcare. This is essentially critical when we're talking about developing and maintaining safe communities. Communities that are equipped with good schools and economic opportunities and access to healthcare are communities that thrive, are the safest communities in Maryland. We must give that opportunity to all our residents so that we can all thrive and actually create spaces that are actually safe for everyone. So we also look forward in terms of ending mass incarceration through medical and geriatric parole. Maryland's geriatric and medical parole system is referred to as one of the worst in the country. And essentially, Maryland is effectively earning an F, and this is based upon comprehensive evaluation as compared to other states. We also know that this population has a decreased chance of returning to jail. We've seen it with the over 200 Marylanders who were released as a result of Unger v. State. They have clearly demonstrated that the recidivism rates for the older population are extremely low, even among those who have been convicted of serious offenses. We've also seen it in the release of individuals under the Juvenile Restoration Act. These individuals are working positive members of the community. And there are many more who are currently incarcerated who could benefit. It is imperative that Maryland improve our medical and geriatric parole processes. This is essential to undo the past harms and really to build a better future for Maryland. We know as people grow older that their risk for committing crime drops significantly, but many still find themselves caged in prison and serving sentences that amount to essentially a slow death sentences. Even dying prisoners are shackled to their beds and often denied family bedside visits, even as they are approaching end of life. Maryland's medical parole process is abysmal. It suffers from any internal coherence. It lacks any formal guidance, and it actually conflicts with information in terms of what is best practices. So here, it gives you a little bit more in terms of the stats, and I remind you that these PowerPoints contain hyperlinks that will take you to the source of the data and provide you additional information. I highlight this, that between 2013 and 2022, Maryland Parole Commission only approved 149 people for medical parole, and in turn denied 464 individuals. You think about the astronomical cost of taxpayers continuing to house individuals who essentially are eligible for medical parole. We also, again, I emphasize here, it's stated again about the medical parole in Maryland is ineffective due to the lack of clarity that currently exists. And we talk about geriatric parole in Maryland is unjustly limited to those who are serving mandatory minimums on crimes of violence. OPD supports improving both the medical and geriatric parole in Maryland, and we're seeking to expand the eligibility. Oops, I think I went too fast. No. Where else are we looking forward in terms of an opportunity to address mass incarceration in Maryland? Maryland's Second Look bill. We are seeking a comprehensive second look bill that proposes judicial review of sentencing after 20 years. Reviewing the sentence of those who have been incarcerated for 20 years or longer is a data-driven public safety approach. Evidence suggests that most career criminals essentially, after that period of time, are less likely to offend again. And we think about the fact that those who engage in crime in young adulthood, after a significant period, 20 years, the data is present that shows people released after decades of prison imprisonment, and that includes those who have charges of murder, have a low recidivism rate. In fact, recidivism rates are lowest among those convicted of the most serious violent offenses for which people serve the longest sentences. And here you have various national organizations that in fact are supporting that very premise. Where else that we seek solution is essentially in terms of community engagement and release planning. We recognize, the Office of the Public Defender recognizes that individuals returning home after significantly long sentences have special needs that must be addressed to facilitate their reentry and promote long-term well-being and ensuring that they in fact are returning to community and are going to be a positive member of society. Through the work of our social workers, peer recovery specialists, and our community engagement coordinator, we devise a plan, a release advocacy plan, and we use a multidisciplinary approach that essentially effectively promotes the health and safety, not only of the individual that we represent, but also of the community. This slide here essentially outlines the detailed four-step approach to engaging social workers and other clients, services specialists as part of our legal team. So at the beginning, the social worker reviews the relevant records, conducts a biopsychosocial assessment to really determine what mitigating information exists, identifies the client's needs, and highlights the portions and information pertinent to the case. Second step is the development of the mitigation report, which in fact details the client's history, identifies the client's needs, and puts together and presents a plan that addresses those identified needs. The mitigation report does become an official record that also contains the client's institutional progress, and it also contains circumstances prior to arrest. So we will speak about any history of trauma, physical harm, substance abuse, as well as any mental health concerns. The plan includes verified referrals of programs that have already agreed to accept the individual for services if released. So this is essentially part of the advocacy report. Before an individual is released, this report is put together, and in fact, it does contain a plan for release, and we do have verified referrals from the programs that are willing to accept the person upon release. The mitigation report, or sometimes referred to as the service plan, is used by the attorney, the assistant public defender, and to negotiate with the state's attorney, as well as to advocate in court. The social worker is an important member of the team because they're really engaging and coordinating the efforts, especially when we're speaking about developing a program, identifying community resources. The social worker is very integral in that plan and works closely in hand with the attorneys to really ensure the successful implementation of the plan. And essentially, the final is the reentry support, where we assist with the connection of the resources. That is also a place where we take into account and use the services of our peer specialists that provide additional support to help ensure the success of the client as they transition back into the community and become productive members of society. So this was really a quick overview in terms of where we came from, what is the current state of Maryland, and also provides an overview of the hope of how we can move in a positive direction in the future, especially when we're talking about ending mass incarceration in Maryland, and creating safer communities. Part two of our briefings is to go out into the community and engage in these discussions. We will have a panel of experts talking about this very topic, and we will be in the Silver Spring, Montgomery County area next Tuesday, September the 24th, starting at 6 p.m. And that will be at the Long Branch Library to further the discussion. And we encourage and invite you all, if you are able, to join us in Montgomery County next week. But if Montgomery County doesn't work for you, we are continuing to speak about the topics that are important to you, that are important to the community, that are important to the clients that we serve. In October, we will be talking about the interrogation of children. And essentially the topic title is Don't Lie to Kids. And we're seeking to reform how we are engaging, how in fact the police are engaging with children, getting rid of the deceptive tactics that are currently used. That will be our October discussion. And in November, we will be discussing safer traffic stops. When we talk about safer traffic stops, we're talking about eliminating harm in terms of encounters between police and drivers, and that benefits not only the drivers, but most definitely the police officers. Around both of these events, we'll also be having a community engagement. In October, we'll be out in Charles County. In November, we'll be visiting Baltimore County. If you are seeking more information about anything that we discussed today, any of the upcoming topics, or you just want to know more about what we do at the Office of the Public Defender, or you would like an opportunity for us to come and speak, especially in terms of Know Your Rights, please just scan the QR code, and that will take you to our website where there is additional information. If you pre-registered for our briefing today, you will be sent additional information, which includes a copy of the PowerPoint. And as I stated, within the PowerPoint, there are hyperlinks that will take you to data and resources and additional factual information in regards to the various parts of this presentation. And as always, this is our contact information. Please reach out to us. I would say email is the quickest and the best way, but here you'll see our phone numbers as well. Please reach out. Any questions that you may have about this topic or any other topics in the criminal legal space, know that the Office of the Public Defender are the experts, especially when we talk about criminal law in Maryland. And as always, thank you, and we appreciate you